Hello, my name is Victoria. I will be your nurse today. Can you please tell me your age and name?
Elizabeth Aubrey, 28.
I can tell patient is alert and oriented ×3. The mood is pleasant. She's smiling. She's well groomed. Nutritional aspect seems appropriate. The upright posture maintained. No obvious deformities noted. So Elizabeth, I'm going to move to looking over your skin now. I'm looking over your skin and I don't note any discoloration, even hair distribution. Skin looks intact and good, appropriate. Next, I'm going to move to your head. I'm going to palpate and feel for any deformities, lesions, anything. I don't feel any. So I'm going to have you clench your teeth for me if you can, please. And I'm going to have you stick out your tongue if possible. And I'm going to palpate your sinuses here. So maxillary, any pain?
Nope.
And frontal?
Nope.
Perfect. Next, I'm going to move to your eyes. So I'm looking at your eyebrows, and the hair is well distributed. Eyebrows and eyes are even on the face. Eyelashes, hair is well distributed and even. Irises are green. Pupils are reactive. Sclera is white. I don't notice any redness or swelling or drainage coming from the eyes, which are all good signs. Next, we're going to do the pen light test, Miss Elizabeth. So if I could have you just look right at my pen light, and I'm going to have you, I'm going to cover one of your eyes, and I'm going to have you look straight at me. Okay, and I'm going to shine a bright light in your eye. All right, and then I'm going to over here, and I'm going to shine another bright light in your eye. Pupils are consensual and have good reflexes. Papillary reflex is intact. Next, I'm going to have you look at my finger, and I would like you to follow my finger with your eyes, only your eyes, not your head. Thank you. So pupils are equal, round, and reactive to light and accommodation. The next test I would perform is a Snellen chart. So I'd have my patient stand up, and I can have her cover up one eye and look at the chart. 20/20 vision, because we do not have a Snellen chart, means that a normal person can 20 feet away can see this line. So can I have you read line 3?
CZO.
And can I have you cover your other eye and read the other side?
CZO.
Perfect, thank you. Can I have you sit back down, Elizabeth? So the eyes are appropriate. And next I'm going to move to your ears. So I'm palpating her ears. Do you feel any pain or tenderness?
Nope.
All right. So I inspected the ears, there were no lesions. Then I palpated, and I don't notice any pain, or I don't note any pain. Next I'm going to move to your nose. Nose is midline on the face, no deformities, no lesions on that. I'm going to check for patency of each nair. So can I have you please breathe in? And then this. Nair's patent bilaterally. Next we will move to the mouth, where can I have you open up, and I'm inspecting her mouth, and I don't notice anything. All teeth are intact. Gums and tongue are pink and moist. Can I have you stick out your tongue and say, ah? Uvula rises and falls. The tonsils are graded at about a +2. And the mouth is appropriate. Next I'm going to move to your neck, which I'm first going to inspect your neck, and I don't notice any abnormalities or lesions from the get-go. Can I have you put your hand, or push your shoulders against my hands? Thank you. And can I have you turn your head side to side and up and down? All right, thank you. And then, so next I'm going to feel your lymph nodes. So I have preauricular, postauricular, I have occipital, then I have the posterior cervical chain, tonsillar, submandibular, submental, and anterior cervical chain, supraclavicular, and I'm going to palpate for carotid artery. Carotid artery is 2 plus on the left side, and carotid artery is 2 plus on the right side. And then I'm just going to feel for trachea midline. And that seems appropriate. Next, I'm going to check for moving to your posterior chest. If I can have you turn. You turn the other way. Okay. So I am inspecting the chest, and I don't notice breathing seems unlabored. I'm putting my hands. Can I have you take a deep breath? Expansion is symmetrical. Then I am going to percuss. Can I have you say 99?
99, 99, 99, 99, 99, 99, 99.
Thank you. Resonance noted. Next, I'm going to tap you on the back here. Please let me know if there's any pain. Any pain noted?
Nope.
Okay. Then I'm going to auscultate your lung sounds. Lung sounds clear and present in all lung fields, and I am going to move towards the front. And we're going to look at your anterior chest, and as I inspect your anterior chest, again, I don't notice any. I don't notice any difficulty breathing. Breathing is unlabored and even. So now that I have assessed your breathing, I'm going to again listen to lung sounds anteriorly. Can you have you take a deep breath and let it out? I'm checking the right side lung. All breath sounds are equal to auscultation, or clear to auscultation. Next, if I could assess your chest we're going to assess your heart next. So I'm going to go down and find your PMI right here, and I'm going to, I don't know any thrills or heaves or lifts. And I found the PMI, and it was all good. Then I'm going to listen to your heart. S1 is heard at the top, and then S2 is heard at the base. Can I have you, now we're going to have you turn back to the middle, and we're going to look at your arms and hands. So I'm assessing your cap refill, which is present, and I'm palpating wrist bilaterally, Well, before I did that, I was inspecting, and no discoloration from the arms, no deformities. Everything appears intact. So I'm going to also have you do some range of motion with your arms. I would like you to lift your arms up, out to the side, up in front of you, and then up above your head, and you're going to lift them back down. Thank you. Now next I'm going to have you lay down flat. Can I have you expose your abdomen for me? I'm inspecting abdomen, and I don't know any, the abdomen is flat and symmetrical, no extra pulsations noted. So I'm going to move to listen to them next. So vowel sounds noted in all 4 quadrants. And then I'm flipping around with the my stethoscope to listen for the aorta. No abdominal bruit noted. Next, I am going to percuss the abdomen. Does this cause you any pain?
No. No pain.
Okay, and then next I'm doing light palpation. All right, and then next we're going to go deep palpation. All right, great, thank you. Any pain without any
No
of those?
pain.
Perfect, thank you. And then I'm going to ask you to put your leg up towards your chest. Okay, then I can have you stand up first. Oops. Oh, no, I mean sit down, sorry. Can I have you stick your leg up to your chest? There you go, and the other leg up to your chest. And we're going to work on abduction and adduction. So can I have you put your legs outwards and push it back in, and then pull it outwards again and push it back in? Perfect, thank you. I'm going to assess your legs now. Your legs, the skin has no discolorations, is even. Hair is well distributed. I am going to check the dorsalis pedis pulse, and that's a 2+. And then I'm checking posterior tibialis, which is also a 2+. So next we're going to move to the next part of our exam. I am going to I'm going to grab a cotton ball, and I want you to tell me where I'm touching you when I touch you, and have you close your eyes, okay? So tell me exactly which body part I am touching when you feel it, and exactly which side.
Right arm. Left arm. Right leg. Left cheek. Right cheek. Left leg.
All right. So then next I am going to have you put your heel at the top of your shin and go downwards. And then again your heel to the top of your knee and go down your shin. Appropriate. And then I would like you to do pronation and supination. So I would like you to rapidly flip your hands back and forth as fast as you can. Very good. Next I'm going to check reflexes. So if I could just have you stick your elbows out like this. So I would, with my reflex mallet, I would hit here, and I would appreciate a small reflex with the fingertips, and again on this side, and I would appreciate a small reflex on the other side. Then again, I would move down here with my reflexes and do patellar reflexes with my mallet, and then I appreciate a small kick. Then again, I would have you rotate a little bit and at your ankle, And then again with this side. And do Achilles. Then next I would test for Babinski and go heel around the big toe. And I don't appreciate a Babinski, so that's a negative Babinski for that, which is appropriate finding. So next we are going to have you stand up, and I would like you to walk to the doorstep for me, please. Gait is it even and appropriate, and then can I have you heel? Oh, can you go back? Can I have you heel to the toes, and heel to the toe, and heel to the toe, and heel to the toe, and heel to the toe? Very good, thank you. And then next I'm going to do a round bird test with you, which I would like you to close your eyes and stick out your arms and put your knee up to your chest and try to make balance as appropriate for age and build. You can do that. Okay, and then we're going to do a range of motion with your spine now. If I could have you bend down all the way and touch your toes and go side to side. All right, very good. You can sit back down, Elizabeth. Thank you so much for coming in, and I hope you had a wonderful day.
Thank you.